Good morning, everybody. It's Monday morning, the 10th of October, and as I mentioned in my Facebook post over the weekend, I'm going to do a really simple series on the guidelines that came out from the World Health Organization, which I think are really neat, and they really encapsulate the key messages around physical activity for different populations and demographics. And today, I want to just deal with this issue of chronic disease, and in particular, today about hypertension. So you'll see that the guidelines are super simple. Is it okay and is it safe to exercise with chronic disease? Absolutely fine. Absolutely, it's safe. And in fact, it's much more dangerous not to. It really is important, though, that if you are under medical guidance from your doctor, particularly with regards to medications, that you discuss, whatever you do with your doctor before embarking on it, because there may be something that you haven't thought through or haven't necessarily had insight into. So, in terms of exercise dose, nothing really changes. 150 minutes to 300 minutes of moderate physical activity if you have a chronic disease. Particular cancer survivors, I mean, this is really big. Type 2 diabetes, heart disease, HIV. These are things that really do, they respond really well to physical activity. Over and above that, though, it is important to add 2 days of resistance training to that protocol. As we said in my talk last week, resistance training is now well established as being as important as cardiovascular training. The other thing that's super important is for older adults over the age of 65, making sure that strength training is functional in nature. So in other words, it's not bodybuilding type movements, it's really functional movements that have a balance component, a proprioceptive component, to really make sure that your resistance training is also focusing on fall prevention. All right, so we know that chronic disease, people suffering from chronic disease, exercise is a good idea. It really is a good idea. So let's move on quickly to talking about hypertension today. That's really what I want to cover. So what is it? So the definition is really that you have a blood pressure of greater than or equal to 140/90, and that needs to be taken on at least 2 different days. What we do here is we always take blood pressure standing, seated, and lying, and we often wait for a while after a patient gets into the practice, because there is a very real thing called white coat syndrome, and just the fact that we are see a doctor who's going to take our blood pressure raises our blood pressure. So if to be diagnosed with hypertension, then you need a greater than or equal to 140/90, and that would then sometimes trigger your primary care doctor to put you on to medication. We'll come to that in a second. Okay, so is it safe to exercise with hypertension? Yes, but here's some caveats. If your hypertension is uncontrolled, in other words, you're not on medication, okay, and it's uncontrolled, and it's greater than or equal to 140/90, it would be a really good idea to talk to your doctor before starting an exercise program. So that's important. If you have stage 2 hypertension, that means that your systolic blood pressure is greater than or equal to 160 and your diastolic is greater than or equal to 100. Or if you already have target organ disease, like your left ventricle of your heart has had changes, you've got changes in your eyes, etc. You really that's where hypertension can be dangerous, and that's where you don't engage in any exercise, including exercise testing, without the clearance of your doctor. So it's safe in general, but the 2 things that are important: 1, if your hypertension is uncontrolled, you're not on medication, and 2, if you've got secondary hypertension, which means your blood pressure is greater than 160/100. All right. Carrying on with exercise training considerations for people with hypertension. So even though we would say vigorous high-intensity aerobic activity, it's not contraindicated. It doesn't mean you can't do it, but the best bang for buck, sort of, as they say, it's optimize the benefit to risk ratio. I would suggest that you look at more moderate, physical active aerobic exercise in particular, and not too much really, really intense aerobic activity. When it comes to strength training, one of the things that's super important is that what we do often when we're lifting any kind of weight is that we inhale and we hold our breath. That's called the Valsalva maneuver. Now, that is exceptionally dangerous because that can very, very quickly raise blood pressure while you're holding your breath. That can very easily get 250 over, 160, for example. So it's not a good idea to hold your breath. So that's super important. You must continue to breathe evenly when you're doing any kind of exercise, but particularly in resistance training when it's more likely that you hold your breath. Okay, so vigorous, I'm not saying that don't do vigorous activity, do so if you like it, but moderate is probably a better idea, and inhaling and holding your breath, never a good idea. Okay, when it comes to medication, there are a few things to take into account here. If you are taking a beta blocker, particularly the non-selective beta blockers, what they do is they reduce your submaximal and maximal exercise capacity. They do that by lowering your heart rate. They don't allow the heart rate to get too high. That's how it manages blood pressure. So it doesn't really help to do a typical sort of exercise-based test to determine the right heart rate intensity, because your heart rate's not going to get up there because of the medication. So in that case, it would be better off to use a rate of perceived exertion scale. And there are a couple of them, 1 out of 10, 1 out of 20. But in this case, if you are on this kind of medication, if you're on beta blockers, I would really suggest that you get hold of an exercise medicine accredited fitness professional. You can chat to us, but work with a professional in this kind of scenario to get the right exercise intensity for you. Now, other medications such as your alpha blockers, your calcium channel blockers, and your vasodilators. Now, these may also lead to a very sudden reduction in post-exercise blood pressure. Because remember, what happens in exercise is you get dilation. That's how exercise works to manage hypertension so effectively. So at the end of your workout, what very often can happen if you're on these kind of medications is that you have lots of blood pooling down in your legs, and your blood pressure drops really, really fast. So, and that can make you feel dizzy, faint. We've seen this many times in fitness clubs over the years. So what's important here is to do a really gradual warm down. You see, I don't use the word cool down, but warm down. So gradually over a 7 to 15 minute period, warm down to make sure that you don't have that peripheral pooling of blood in your legs, which can make you feel like really nasty. So any medication for hypertension, please be super careful. Find out if you're not sure. Doesn't mean again that you can't exercise, just means that you need to take appropriate care. Okay, so last thing for me today, what's the dose? What kind of dose do you need to take? So if you see down the bottom here, the prevention of cardiovascular disease, hypertension, or dyslipidemia, we are looking for an exercise dose of about 17.9 kilocalories per kilogram of your body weight per week. So what you simply do, take your body weight, multiply it by 17.9. That will give you your energy expenditure that you need to do in a week from exercise. Not from walking around normally, but from exercise. What's important for hypertension is to be frequent as well. That's important because that's how you over a period of time, why exercise is such an effective medicine for hypertension. Every time you exercise, you get vasodilation. Your blood vessels dilate to allow more blood flow to travel to the working muscles, and that dilation will stay in place for up to 2 hours after your workout. So your blood pressure is actually decreased for periods after your workout. Now you do that enough times and you get a nice adaptation effect, and you can start to look at coming off medication, talking to your doctor about dropping dose, etc., etc. But that's how we manage blood pressure so effectively with hypertension. There are other ways to do it. There are other things that exercise does, but in a very simple way. That's the one why frequency of exercise is important. Okay, so 6 days a week or 7 days a week is a good idea, and at least 30 minutes a day. So going back to that, to the slide we had right at the beginning, between 150 and 300 minutes of moderate exercise, between 75 and 150 minutes if you want to exercise vigorously. So I hope that helps a little bit. I hope that adds some value around exercise dose for chronic conditions, and particularly today in hypertension. And tomorrow I'm going to deal with another one of the really, really big and common conditions, which is diabetes, and we'll talk diabetes tomorrow. Hope everyone has a great day. Stay active, have fun, and chat tomorrow. Bye.